similar to them, which is pilocarpine. Okay, let's take acetylcholine. It works both on muscarinic and nicotinic receptor, صح? You remember from this هنا, صح? Acetylcholine is equally acting on these receptors. However, it is very, very susceptible to cholinesterase, and that's why the half-life of acetylcholine is only 5 seconds or 20 seconds, very short acting, because it's very highly susceptible to being broken down by the cholinesterase enzyme. Okay, if you want to develop drugs, they must be more longer acting. يعني there is no drug that we can give 5 seconds. صح ولا لا? So we need actually medications or drugs that we develop to be more longer acting. And that's why methacholine, carbachol, bethanychol, it's not required from you to know the half-life, but it's about an hour, okay, which is a great progress when you compare that to 5 to 20 seconds, of course. So why they maintain, or why they have a longer half-life? Because they are not susceptible to the breakdown of cholinesterase, and they will be broken down by liver enzymes or whatever. When you choose them, when you choose a certain medicine, you need to know which receptor you want to act on. Methacholine, for example, it works on muscarinic, but no effect on the nicotinic receptors. Carbachol can work in both, and bethanychol can work in muscarinic and not nicotinic receptor. And even when we say muscarinic receptor, they might be a preference to a certain subtype, more on the glands, more on the GIT, more on the heart, something like that. Okay, this is the organ effect of the direct acting cholinergic agonist. Or that's the table basically to explain to us what acetylcholine is doing in our body, right? Eye, CVS, respiratory, GIT, genitourinary, and glands, all of this is muscarinic, through muscarinic receptors. And centrally, we have nicotinic as well as muscarinic, and this junction at the bottom here is on the nicotinic receptor. Okay? Let's see now what acetylcholine is doing. First of all, in the eye, it is growing contraction of the pupillary scleral muscles. And that was osmosis. Okay? And the second effect, contraction of the ciliary muscles, and this is a condition, making the eyelids suitable for breathing. And both of these two will facilitate the aqueous humor flow. Do you know what is the aqueous humor? What is the name of the fluid in the eye? Aqueous humor. Okay. Have you heard about glaucoma? الماء الأزرق? Anybody knows what's glaucoma? طب ما تعرفونها بالعربي المويه الزرقاء حد يعرفها what is it? It's increased intraocular pressure, because this aqueous humor that we're talking about, this fluid is building up without proper drainage. Okay, let's see now what happens. And I like to use diagrams. The size of the pupil in our eyes is controlled by two types of muscles: pupillary constrictor muscles and pupillary dilator muscles. Okay, and from the name, constrictor, that means they will constrict, and dilator, they will dilate. How they do that, it depends on the anatomy of those smooth muscles, okay, of the iris. So if the pupillary constrictor muscles, these are circular muscles. Do you see the blue arrows? This is their alignment. So they are aligned in a way that they are circular. If they contract, what will happen? Yeah, the pupil becomes smaller because the contractility is shorter. They will become shorter, okay? So this is actually more of a function of parasympathetic nervous system or acetylcholine. Look at the pupillary dilator muscles. These are radially arranged, يعني زي الشعاع كده, okay? Do you see them? The blue arrows is pointing to them. What will happen to them when they contract? When contract becomes shorter, so they will open up the pupil, and the diameter is going to be bigger, okay? So normally our pupils are controlled by both parasympathetic and sympathetic, okay? Dilator and constrictor. Which one is dominating? So if we're having parasympathetic dominance, then the pupil is going to be small, and sympathetic, then the pupil is going to be big, okay? So this is the pupillary constrictor muscles by which acetylcholine is working and causing a small pupil or meiosis. Okay, look at this. This diagram shows you how the aqueous humor circulates inside the eye. Okay, It is secreted here from the posterior chamber by the ciliary. هنا اسمه مكتوب هنا مكتوب في الواقع ciliary body. The ciliary epithelium on the body itself secrete aqueous humor. So it is secreted from the back of the eye. It needs reabsorptions from here in the anterior chamber. So it needs actually to go, this is the lens, this is the iris, and this opening is the pupil, صح? It needs to go with the black arrow from the posterior chamber back to the anterior chamber. This is where it is being reabsorbed from the trabecular meshwork and then it goes to the canal of Schlemm. Okay, it is coming from blood and then reabsorbed back to the blood. Okay, so this process of secretion and reabsorption. It has to be very nicely, timely manner. It needs to be regulated, because if there is so much secretion and reduction in the absorption, it will lead to glaucoma. This is the disease that I asked about, because increased intraocular pressure. There's so much pressure inside the eye because of aqueous humor. Okay, so knowing that it goes this way, this is important because it says if you make the pupil small or if it produce meiosis, it will increase the drainage. How is that going to be? Do you see the iris here? Okay, if we have meiosis, what will happen? It will be pulled to the center, صح? And it will open up this angle. That's what I want to say. If you produce meiosis, okay, the iris instead of this, it will become contracted and brought to the center. So حيفتح الانgle. Okay, so it will open this angle for us, and that will help with the aqueous humor reabsorption. Again, when the ciliary muscles are contracting and making your eye suitable for reading, the eye lens, what is the shape that will happen to it? Accommodation reflex في الeye. خدتوه في physiology. The eye becomes more convex, more to the center. And they say that actually bringing the lens to the center and becoming more convex for reading, again, it will open this actually pathway. So we're basically talking about two mechanisms by which we are enhancing the outflow of aqueous humor and facilitating it to reach the site of reabsorption. So does that help in glaucoma or not? Depends on age. Yes, yeah, basically. Or if somebody has got glaucoma or increased intraocular pressure, you will study cholinergic agonist as one of the actually most important group of drugs, okay, by causing this meiosis and contraction of the ciliary muscles for accommodation. That opens it's like a geometry kind of changes that happens. Okay, what will happen to the heart with the parasympathetic nervous system? Slow heart rate by affecting the SA node, which is the chronotropic effect, where actually this is where the control or the generation of impulses starts. And AV node is responsible for conduction, صح? So this is a dromotropic effect. It's going to inhibit both, so we will end up with having lower heart rate. Force of contractility of atria and ventricles, reduced, exactly. Respiratory, the bronchial smooth muscles, they're going to contract with acetylcholine. So the diameter is going to be narrower, okay? Secretions all over the body is increased by acetylcholine. Okay, so even the bronchials in the goblet cells or whatever inside the tracheobronchial tree, they will secrete so much. GIT, secretions of everything, starting from saliva. Okay, لا خليها مع الجلاندز هتكلم عنها. في GIT, what will happen to the motility of the smooth muscles in the gastrointestinal tract? Increased. What will happen to the secretions of the gastric enzymes in general? Increased. And what will happen to the sphincters? Relaxed, okay? Genitourinary, it's again, the detrusal muscles of the urinary bladder will contract and the trigone and urethra is going to relax, and that will facilitate urination. Other glands, all of them, sweat, lacrimal, nasopharyngeal, all of them will increase their secretion, okay? Why? Because the parasympathetic nervous system, in order to help you to learn this table, it's rest and digest. صح? We know this, okay? So you need to rest. That's why you don't need a very fast heart rate or force of contractility and high blood pressure, right? Because you are just resting and you are digesting your food and you are excreting the waste products. That's actually what means by rest and digest. CNS, acetylcholine is a very important neuromodulator. This actually effect of acetylcholine on the alertness and learning process, it's not by only acetylcholine, but it interacts with cholinergic signaling is a complex actually phenomena by which it involves glutamate and dopamine and other neurotransmitters. Neuromuscular junction, طبعا we know that acetylcholine and slightly nicotine is going to produce depolarization of the endoplate and muscle contractility. Okay, واضح هذا الكلام؟ Because when we study cholinergic antagonist, we are going to نعكس هذا الجدول كله. تمام؟ Excellent. Yeah. Now let's look at the indirect acting. يعني احنا in this table we have taken, this is the effect of acetylcholine, and if methacholine, for example, is working, or pilocarpine, or the other drugs that are working directly on acetylcholine receptors are going to affect or produce similar effect, or يعني, in a way or another, right? But when we say indirect acting cholinergic agonist, what do we mean? Yeah. So they are not actually similar, very similar to the structure of acetylcholine. Now go to this receptor. No, they are actually going to interfere in the enzyme responsible for acetylcholine breakdown or metabolism. Because as a synaptic reflector, what you find on these waiting for acetylcholine to be released. You give a chance of seconds to reduce acetylcholine, then it breaks down choline and acetate. Okay? So these drugs are going to cause what? They will make complex binding with the enzyme. If the enzyme is being bound with something, it's not our work efficiency. And if you have acetylcholine, increased bioavailability of acetylcholine and buildup. Okay, excellent. We have three chemical groups that will reach these drugs. طبعا you're not trying to know the chemical group. And I put that for you because I want to know why they are different. And there is significant difference between them. The structure is different. Okay. The first one is hydrophonium. Hydrophonium actually under a group called quaternary alcohols. So these are simple alcohol and has got quaternary ammonium group. Okay. So do you expect it to be highly lipid soluble or not? From what I've just said. Yes, and I go to quaternary ammonium. Less, yes, exactly. So it is less lipid soluble compared to other things, and that's why hydrophonium is less lipid soluble. When we say carbamate esters, these are esters of carbamic acid. That's a different group in their structure. And again, esters of carbamic acid, they are not actually highly lipid soluble, all right? But when I put asterisks here, this asterisk that you can see, it means that this drug is an exception to the group. So what do you expect physostigmine to be? Yeah, highly lipid soluble. Okay, excellent. And when we say organophosphate, these are organic derivatives of phosphoric acid. This is a completely different group. And again, it is highly lipid soluble. But this drug in particular, icothiopate, is less lipid soluble, so it's like a polar compound, all right? But this is actually the medicines. Hydrophonium works for 15 minutes, neostigmine for 4 hours, and pyridostigmine up to 6 hours. Physostigmine is 2 hours. And icothiopate has got a very long half-life, and that's why we do not like to use it. You do not like to use anything that works for 100 hours. That's too long for actually titration or reduction in dose. But I will tell you in which situations we might be using it. Okay, look at this type, this column basically. Okay, we have carbaryl, we have soman, salmon, parathione, and malathione. What are these? These are actually chemically related to the group that's actually opposite to it. But these are not medicines. These are developed to be something, to kill a living organism. Okay, so basically you can kill insects by insecticides. you can kill people by nerve gases or nerve agents. واضح? Okay, so these are actually, this is the classification. Now, I've told you that carbamate esters, they are polar, okay, and this lipid soluble with negligible distribution to CNS. Physostigmine is an exception, and it has actually very lipid soluble, can reach CNS. Organophosphates are well absorbed from every route of administration. Why we need insecticides and why we need nerve agents to be highly lipid soluble? Hmm? Yeah, because if you are a farmer, for example, and your farm has got rodents or lizards and insects, and you want to kill them, are you going to give them something that they need to eat first and then die, or you want something that you can spray from a يعني, a faraway distance, and then that will kill the whatever يعني, insects that you're having? Okay, the thing that you spray from a distance and yet can be absorbed efficiently is the highly lipid soluble preparations. Okay, because they are going to be absorbed from the eye, from the bronchioles, from the skin itself. Okay, so that's why you just spray it from a long distance and it's going to kill that animal. The same principle that happens with the nerve agents. What do you know? No, what do you know about nerve agents? They are weapons of mass destruction, صح? They're used in wars to kill people. How they are actually sort of يعني delivered either by, sorry, yeah, and مش mechanism. Actually, you're either by blast, for example, or by atomizers. Sometimes they hear an explosion and then these are liquids and then change to vapor, and then the people will start to breathe them and then they will definitely die because they are made in such a way that they're highly lipid soluble. So even from they do not need to, for example, to get exposed to them or drink them. It's just by the exposure of the skin itself and the bronchial airways to them, then they are going to kill these individuals. Right? Now, why we have differences in half-life and differences in structure? What's the time now?
It's 9:44.
طيب يعني we stop ناخذ
You want to stop it?
انتوا تبغوا بريك الان ولا؟
There are two lectures. But
ايوه yes.
So this is the first lecture is done ولا؟
لا لسه ما خلصناها بس يعني ما في مشكلة whenever. Shall I continue بعدين ناخذ بريك ولا كيف؟ So tell me then when you want the break. Okay, so what is the difference and why the half-life of hydrophonium is different from neostigmine, different from ecothiophyte or organophosphate? Why they are different? Because the hydrophonium, we said that these drugs are going to make a bond with the cholinesterase. What is the type of the bond and how long it's going to last? This is the difference that actually makes half-life is different, okay? Hydrophonium is going to make a hydrogen bond, and hydrogen bond with the enzyme. And hydrogen bond, if you study your basic in pharmacology, this is the weakest bond. It's very weak and very short-lived, and it's going to be undergo splitting and will release the enzyme. So the enzyme will be back again to function, okay? And that's why they're working only for 2 to 10 minutes. But the carbamate esters, why they work for hours? Because they make a different type of bonds, which is covalent bond. Covalent bond is stronger and can last for 2 to 3 hours without being without undergoing splitting and releasing the enzyme. Once they release the enzyme will do its job and it's going to break down acetylcholine, okay? However, in the organophosphates, which is we have only ecothiophyte, we use it as eye drops if we want, because it's very, very long acting, so we do not like to use it systemically. We can use it as eye drops in cases that we have a glaucoma, for example. But the organophosphate, once we make them as insecticide or as nerve agents, then you want actually a very long half-life in a way that the bond that you create with the enzyme is going to be very strong bond and undergoes a process called aging. What does that mean? It means that the insecticide will come, for example, and make the bond with cholinesterase. But within 10 minutes, aging will happen, especially with the nerve agents. And they're structured in a way that From the name, what do you understand from the word aging? Yeah, something becomes stronger and very resistant and very stubborn. This is what we mean. So the bond itself, it becomes stronger with time. After 10 minutes from making that bond, it becomes actually strong enough that you cannot actually break it down. Okay? And that's the purpose of doing such thing with these nerve agents, because the purpose is not to treat, the purpose is to kill. Okay? So you want to make sure that the enzyme is not going to be released back to function physiologically. Okay? And this aging happens within 10 minutes. If the exposed individual was lucky enough to have a hospital nearby, they can do something and they can treat and give the antidote. Okay? But the problem is, under which circumstances, in war circumstances, that somebody can have an access to hospital within 10 minutes. طبعا very, very small chance, and that's why people die, unfortunately. So this is actually the process of strengthening the bond between the two. It will happen with time. And direct acting cholinergic agonist, the one that I've just told you, the neostigmine and peridostigmine, neostigmine, as well as the insecticides, as well as the nerve agents. Do you expect the organ effect for them is to be similar to acetylcholine? Huh? لا ليش opposite? Yeah, is it similar in magnitude, similar in is this table supposed to be like the other one?
Maybe from the duration.
Yeah, long duration, yes. Similar in a way that they will affect different organs and produce something, yes. But you have to be prepared that this group, the indirect acting cholinergic agonists or cholinomimetic agents, include medicines and toxins. صح? So that's why there might be actually some difference in them. If you're using them as medicines, they will do something like acetylcholine. But if somebody is getting exposed to insecticide or a nerve agent, then you should be actually seeing the extremes and different features. صح? Okay. So the effect on the eye, respiratory, GIT, genitourinary, the same. The salivation, meiosis, okay, increase lacrimation, diarrhea, for example, increase urination. All of that is what we expect. However, there are effects on the cardiovascular and CNS, and that might be actually responsible for somebody with the fatality that happens in these cases. Because it's very important, somebody will die, that the heart and the brain is being affected differently. What will happen to the heart? We know that the heart, once there's actually so much acetylcholine, there will be bradycardia, and there will be reduction in force of contractility and reduction in cardiac output. This is what we know. However, you might see some individuals who are having a rise in blood pressure through vasoconstriction and a rise in the sympathetic systemic vascular resistance, SVR, or peripheral vascular resistance. Sometimes you see it mentioned differently. So if there is an element of vasoconstriction, that increases the systemic vascular resistance, increases blood pressure, okay? This is something not related to the acetylcholine, صح? Can anybody tell me the mechanism? Why you will see a rise in blood pressure if somebody is being sort of intoxicated by indirect acting cholinergic agonist? One of the earliest، عشان كذا أنا حطيت السلايد الثانية هذه. ها؟ فين؟ هنا. أيوة. أيوة تفضلي. لا there will be no time for RAS. You mean RAS system sort of trying to compensate for the... لا, that's not. There's something faster. Huh? لا. Huh? What is this? Yeah, if you have acetylcholine build up, okay, don't forget that acetylcholine not only work here. acetylcholine will work on the autonomic ganglia, صح? So it's going to increase the transmission of both systems, the sympathetic as well as parasympathetic. Yani now we have gone beyond the picture that characterizes by the cholinergic agonist. Okay, if you're having so much acetylcholine, then it's going to stimulate the autonomic ganglia, and another system will be involved. Yalla, sympathetic nervous system معانا. Okay, and again, don't forget the adrenal medulla is very rich source of epinephrine, norepinephrine, and gets stimulated by acetylcholine, isn't it? So basically now you're having both systems are overactive. So in case somebody gets intoxicated by insecticide, because this is the toxic situations, not somebody's taking the therapeutic dose of peridostigmine, for example. No, we're talking about nerve agents. We're talking about exposure to insecticides, the toxic agents, okay? Once you're having some toxicology situation, then acetylcholine is going to produce something else. So if you see the patient having, for example, slow heart rate, but for example, after a few hours, blood pressure is high, and you as a treating physician don't think, oh, my diagnosis is wrong. No, your diagnosis is right. This is, again, organophosphate exposure. But the problem is what? You're having actually your physiology. You need to know your physiology very well. This is part of the pathogenesis that happens because of the toxicity situation, okay? But they say at high or at toxic doses, basically the parasympathetic picture dominates over the sympathetic. But in case if you see something related to the sympathetic nervous system, don't be surprised, okay? Like, what will happen to the CNS? If you are having a low concentrations, not low, I mean that therapeutic, within the therapeutic range of maintaining acetylcholine concentration, you will see actually alertness and increased concentration, and that will help with your concentration. But if you are dealing with a toxic situation, okay, then the acetylcholine is going to definitely, it actually has got a complex signaling mechanisms with too many neurotransmitters in the brain, and they might have convulsion, coma, and the convulsion itself is enough to actually shut down the respiratory center and respiratory arrest. Neuromuscular junction, what will happen? If you are building up acetylcholine, what will happen? Yeah, increased contractility of the skeletal muscles, which is good, all right? But too much acetylcholine, what will happen? Too much acetylcholine. Fibrillations of the muscle fiber, you will not see it by itself because this is actually a contractility of a certain muscle fiber. But fasciculations, something that you can see by your eyes because it's a group of muscle fibers are contracting together. So you can see it on the skin itself, okay? There will be a situation called depolarizing neuromuscular blockade. Okay, what does that mean? It means that by giving acetylcholine with so much concentration, it will produce, the action potential phase 1, it's the depolarization phase with the entry of sodium ions, okay? So basically there will be depolarization because acetylcholine is there, but there will be no repolarization because acetylcholine concentration is so high. So the muscle will undergo a block. We call it phase 1 block. Depolarized cannot repolarize back again, all right? And that's why they say this actually phase 1 block is followed by phase 2, which is a desensitization. Yani even when it repolarizes, it is no longer sensitive to acetylcholine. So if it loses sensitivity to acetylcholine, what will happen to the muscle? It will not contract. What is the other name for it? Yes, excellent. It will undergo paralysis. Okay. Do you see now how many mechanisms of death we can have if somebody has got exposed to nerve agents or a toxic dose of insecticides? I hope that it's clear to you. Now, whether we are talking about direct or indirect, طبعا not the insecticide and organophosphate, we're talking about neostigmine, peridostigmine, edrophonium, and bithacholine. These ones are the cholinergic agonists. In which situations we need them? What are the clinical indications? Yalla. Where we use them? In the eye? Do we use them in glaucoma? No. Yeah, I've just told you that they produce meiosis and increase. احنا لساتنا في الصباح يا جماعة ايش فيكم؟ Okay, we said that meiosis as well as the accommodation reflex, right? It would make the aqueous humor flow easier in the eye. So that's why we can use them for treatment of glaucoma or in meiosis. Very good. Second indication, after lens implantation with cataract surgery. Do you know what is cataract? الموية البيضاء. Okay. The cataract means the eye lens is opaque because of diabetes, old age, whatever. We need to take it out and put another artificial lens inside. Okay. How do you think that we can do that under local anesthesia? We need the pupil to be very, very wide, open. صح? So we gave mydriatic drops to open the pupil, take that lens, put the new lens, suture, okay, and then are you going to leave the pupil wide? Actually, even after the surgery for a few days before the healing process, they cannot withstand looking at very bright light. So it does help the patient that we cause meiosis only for 2 to 3 days until healing process happens and then the lens can see properly, okay? So that's why after cataract surgery, we might need these eye drops to cause meiosis to help or to spare the patient from seeing halos of light or being very uncomfortable with bright light after the surgery. Clear? Yeah, and for that reason, we use pilocarpine. Pilocarpine has got a more sort of effect towards the towards the eye itself and the glands. GIT, genitourinary. In which situation do you want to increase motility and relax sphincters? Sorry? Yeah, not the normal one, but there should be something very pathological and genuine that needs medication for it, okay? Because these medications are not actually, these medications are, I would say, dangerous medications. So, affecting heart rate and صح ولا لا? So you want to spare them to a very genuine situations. It happens after surgeries, post-operative ileus, paralytic ileus. It happens that when somebody has gone under general anesthesia and taken general anesthetic, these cause some atony. The muscles will not contract normally after the surgery because of the effect of the medication. This is a short-lived condition or temporary situation, okay? So they will have sort of this constipation, they're not moving their bowel. So what you want to do is to give them, some doses of methanicol, for example. It's very efficient and that purpose. So, but make sure that there's no obstruction. Not they are constipated because there is a mass or tumor or something like that, okay? So any situation, urinary retention, sometimes after prostatectomy, major surgeries, they just cannot contract, okay, and cannot empty the urine. So instead of doing catheterization every now and then, you can take these medications. Have you heard about Sjogren's syndrome? Sjogren's syndrome is an autoimmune disease that affects the lacrimal glands and salivary glands. They have dry eyes and dry mouth. You want something that works on the glands and make them secrete more secretion. What is that thing? There must be cholinergic agonist here that helps. But we will choose again the agents that are more selective to the glands rather than the heart. Do you see what I mean? There are certain subtypes. So pilocarpine is a very good agent for the glands. But some people, they say pilocarpine causes excessive sweating and civimylin is more to the lacrimal and salivary glands. So there are little differences that I will not ask you about the exam, but just know that we do have like 2 options for Sjogren's syndrome. Have you heard about myasthenia gravis?
Yes.
What is myasthenia gravis? Yeah, this is an autoimmune disease by which they have actually weak muscles because they have autoantibody occupying nicotinic receptor and will not allow acetylcholine to stimulate the muscle to contract, okay? In order to treat myasthenia gravis, you need to increase the bioavailability of acetylcholine. And we do that by neostigmine or pyridostigmine, one of these medications that I've told you. Do we have now the adverse effects? Can I continue ولا تعبتوا تبغوا بريك؟ ما عندي مشكلة في anything. بريك؟
Yeah, we do break.
سمعت بريك اتفضل خلاص 10 minutes إن شاء الله.